Hi, my name is James, and I'll be performing a partial health assessment on this patient, AGF. This assessment will include the overall behavior, general appearance, mental status, as well as the skin, hair, nails, head, face, neck, and regional lymphatics. Alright, as we can see, our patient is awake and alert. She responds well to stimulus. And I'm gonna give you 4 words to repeat to me at intervals, okay?
Okay.
The words are pear, sunshine, fish, and happy. Okay, can you repeat those to me?
Pear, sunshine, fish, happy.
Okay, good. Her speech appears to be clear. She's fluent. She is moderately paced in her speech. There seems to be no slurring or stuttering. Okay, as we can see, our patient's posture is erect and relaxed. Her body movements seem to be normal. There's no involuntary body movements going on here. Facial expression is relaxed and appropriate for the situation. She is dressed appropriately for her age and season. There appears to be no physical abnormalities or deformities that we can see. Could you tell me your name and date of birth, where you're at, and about what time it is?
My name is AGF. My date of birth is 9/25/1992. I'm in Clemson, South Carolina, and it's around 7 p.m.
Okay, thank you. We can tell that her speech is clear and appropriate. It's moderately paced, and at this point I'm going to ask if you can recall the 4 words I gave you earlier.
Pear, sunshine, fish, happy.
Okay, thank you. Okay, upon initial inspection of the patient's skin, I can tell that she is tanned, and I will ask, do you expose yourself to sun?
Yes, I do.
Do you use sun protection?
Mm-hmm.
Okay.
I have a sunscreen.
Her skin tone appears to be natural for her ethnicity and race. There seems to be no discoloration on her face, on her arms and legs. There are noted freckles randomly throughout her extremities. There seems to be no lesions. Do you have any scratches, scrapes, moles, or anything that you know about?
Nope.
Okay. Upon inspection of her nails, they are clean and tidy. Her palms appear to be a slightly lighter shade of skin color. And down looking at her feet, they seem to be the same color. There's no cyanosis or discoloration noted throughout. There are some calluses at the base of the great toe. Are you an athlete?
I'm a runner.
You're a runner? Okay. Alright. Patient's skin seems to be warm, dry, to the touch. Do you use moisturizer?
Sometimes.
Okay. The skin turgor, as I pull up the tent, it's non-tenting, so she seems to be well hydrated. When inspecting her nails, the nail beds seem to be pink with a capillary refill of less than 3 seconds on all 4 extremities, and I'll check the toenails. And if their toenails are painted, you can squeeze the toe to the side, the tissue, and it should also give you a good reading on their peripheral vascular circulation. There's no clubbing noted. The angle of the nail appears to be less than 180 degrees upon inspection, and there are no ridges, and they do appear to be trimmed appropriately for her profession. Upon inspection of the patient's hair, we can say it's long, neat, and brown. The distribution appears to be normal throughout. We look all the way around here. Does not seem to be any excess hair growth or lack of hair growth throughout. Upon initial palpation, I'm going to touch your head here, and just let me know if you have any tenderness. Nothing hurts there? Okay.
No.
The hair seems to be healthy. It is not brittle. There is a little bit of hair on her forearms bilaterally, no hair on the legs. Do you shave your legs?
Yes.
Okay. As we can see, the patient's head size is normal. There seems to be no deformities. Everything seems to be symmetrical. All the facial features, the eyes, the ears are aligned at appropriate height. The nose is at a normal area. The mouth has no drooping. I will palpate her temporal artery bilaterally, one at a time. I have +1 pulses bilaterally, and there seems to be no hardness or distension. I'm going to touch your jaw here and ask you to open your mouth, open and closed. Okay, the temporomandibular joint is intact. There doesn't seem to be any crepitus here. It is not partial to one side or not, and it's even when open and closed. Her facial expression, as said earlier, is appropriate. I will ask you to smile. Can you blow out your cheeks for me and puff them up? Okay, can you frown? Can you lift your eyebrows up? Okay, good. The patient's cranial nerve 7 is intact. Now to check for cranial nerve 5, I will touch the patient's face in various areas. This will assess for her pain and pressure with a sharp and dull. I'll ask the patient to close her eyes and either give her a sharp or dull pressure at various areas of her face, and you will tell me where I touch and what it feels like. Okay?
Okay.
Okay, close your eyes for me.
My right cheek and dull pressure.
Okay.
My chin sharp.
Okay.
My forehead sharp.
Good.
My left cheek dull.
Okay, thank you. And to test for the temporal and masseter muscles, I'll ask you to clench your teeth for me. Okay, and open your mouth. Alright, and now as we can see that the patient opens the mouth and clenches teeth with ease, and those muscles are intact. Now for inspection of the neck, can I ask you to look forward for me? And tilt your head back a little bit. We can see that the trachea is midline. There seems to be no deviation. There's no pulsations noted. I'll palpate the carotid artery bilaterally in front of the sternocleidomastoid muscle. I have a +2 pulse on this side. You check one at a time. And I have a +2 pulse on this side as well. I can palpate the trachea one side at a time. There doesn't seem to be any deformities here, and palpate the thyroid as well for size and shape and any discomfort. Okay, now I'm going to palpate the regional lymphatics of the head. I'll start with the preauricular bilaterally. And there seems to be no enlarged lymph nodes here. I'll move to the post-auricular. And I can feel an enlarged lymph node bilaterally on the preauricular in this patient. I will then move to the tonsillar. No abnormalities here. I'll move to submandibular. I can palpate a slight lymph node in the left side here, and submental. No lymph nodes palpated here. I'll move back into the occipital, and I do not feel any lymph nodes here. Now I'll move down to the cervical chain here, the deep cervical chain, and pre and post, and I do not feel any abnormalities or lymph nodes there. And then I'll just move up to the supraclavicular lymph node region, and there are no lymph nodes palpated there. Okay. At this point, I will test for cranial nerve 11 and test the strength of our trapezius muscle, and I will ask you to push up against the resistance I press. Okay. She's strong bilaterally there. There doesn't seem to be more weakness in one muscle or the other. And I'm going to push resistance against your face here. And you push against that. And then this side as well. Okay. And can you touch your chin to your chest for me? Okay, and now your chin to the sky. And can you try to touch your left ear to your left shoulder? And right ear to your right shoulder. Very good. There seems to be no difficulty or range of motion in her neck and head movement. Thank you.